that young children will soon be able to get the COVID vaccine. Senior health correspondent Monica Robbins reports on the latest on the Pfizer vaccine.
Pfizer claims its COVID vaccine is effective in 5 to 11-year-olds and will now apply to the FDA for emergency use authorization by the end of this month. Their trial included 2,000 kids and concluded the vaccine is safe, well tolerated, and showed a robust neutralizing antibody response.
Even at smaller doses, because we're not giving the adult dose to these smaller children, we're giving about a third of that, and yet we're seeing a very, very good antibody response.
But Dr. Esper says there's a difference in this type of antibody response. Protection shows up later.
After 2 doses, a month after the second dose. So the doses are given 21 days apart. So we're not really seeing the protection until about 2 months after.
Cleveland Clinic currently has 8 children being treated for COVID, all of them unvaccinated, most over the age of 12. News of a vaccine for smaller kids is bringing hope, considering the Delta variant has caused pediatric cases to jump 240% since July.
We're not going to get this vaccine ready for 5 to 11-year-olds, next week. It still has to go through all the rigors and the protections of the FDA to ensure its safety. We need to review the data ourselves.
And Monica is here. We do have to make one clarification. The number of CDC flu deaths from 2010 to 2020 is 321,000.
Yeah, over a 10-year period, and COVID in 18 months has already doubled that. And Pfizer and BioNTech are also testing their vaccine in children under 5 and expect results from that trial by the end of the year.
Now, what about boosters? It's still a lot of confusion. Today's September 20th. The date the president's booster program was supposed to roll out, but then, as we know, on Friday, the FDA did not greenlight that. So what's going to happen now?
Yeah, I'm sure that was a big surprise for the administration. Now, boosters were approved for those 65 and up and those at high risk with underlying conditions. I think the jury is still out on this one because the panel wanted to see data relating to different ages, and Pfizer did not provide that. So we do know the Pfizer vaccine efficacy wanes much faster than Moderna after 6 months, but we also know that while there may be breakthrough infections, it's still protecting people from hospitalization and death. And so people may get wicked colds, but the vast majority will get over it. And this one right now, as for boosters for the rest of the general public, is going to be a wait and see.
Okay. Also new today, the president making a move on travel restrictions. What do we know there?
Yeah, he's planning to lift foreign travel restrictions into the U.S. beginning in November and allow foreign nationals into the country if they have proof of vaccination and a negative COVID-19 test. Now, the new rules replace a wide range of restrictions that had barred non-citizens who had been in certain countries in the prior 14 days from entering the U.S. It would allow families and others who've been separated by the travel restrictions for 18 months to plan for those long-awaited reunions. Wow. So good news, but bottom line is travel is easier for those who are vaccinated.
All right. Thanks for keeping us up to date.
Sure.